Hello, dear friends, and welcome to IVMED webinar. That is the series of educational webinars held by fertility specialists of Medical Center IVMED and IVMED Family, IVF and Surrogacy Agency. I want to remind you that we are located in Kiev, in Ukraine. My name is Nadia Milenevska. I'm a head of International Department for Customer Servicing at Medical Center IVMED, and I am a director of IVMED Family Agency. We have a topic for today: egg donation, egg cell cryopreservation, and treatment options at Medical Center IVMED. I would like to introduce to you our speakers. The first speaker is Birol Aydin. He is director of IVF laboratory at Medical Center IVMED. He is a senior embryologist, official expert of Society for Human Reproduction and Embryology at Medical Center IVMED. And the second speaker is Galina Strelko. She's a medical doctor. She's obstetrician gynecologist, fertility specialist, head doctor and co-founder of Medical Center IVMED. Which issues we will discuss today? We will discuss how to choose egg donor, to which medical and legal criteria should correspond an egg donor to participate in IVF program, the option of pre-implantation genetic testing of embryos in egg donation programs. Is it necessary to use only fresh oocytes in IVF program? Which advanced laboratory technologies of oocytes cryopreservation are available at Medical Center IVMED? And how the IVF programs with frozen egg cells can save your budget and bring you the desirable result in getting pregnant. So let's start. Birol, please, you can begin.
Sure. So hello everyone, my name is Birol Aydin. I am IVF Laboratory Director of IVMED Clinic. So today we will try to talk about egg donation and donor egg cryopreservation, how we are creating a cryo egg bank, how we are using that actively for our patients, which program give much more benefit for you. We will discuss as financially, as theoretically, also practically, which will help you much more. Of course, when we talk about oocyte donation, first we should know there are two kinds of the oocyte donation program. First, as you prefer, you can use fresh donor, and second one, cryo egg bank as frozen donor oocyte. If we talk about fresh donor cycle, so there is some kind of algorithm for oocyte donation. So first, need a recipient evaluation. So we need to know about recipient with our IVF specialist. We need to monitorize them, make a blood test, estradiol levels. So, and then second stage, of course, we have special donor agency as IVMED. So we have donor recruitment, donor screening. We have special consent form each for recipient and donor. So both sides get a kind of safety and security. Also, of course, important, we need to synchronize if we are using fresh cycle, donor and recipient. So we have, through our IVF specialist, prescription of hormonal therapy, of course, ovarian stimulation of the donor, ovarian oocyte retrieval, ovum pickup of donors, of course, fertilization of the oocyte, plan of embryo transfer, and of course, maintenance of the pregnancy by our IVF specialist. So who require egg donation? Of course, egg donation program needs special criteria which patient can choose such program. Of course, who have lost their egg cells after the special chemotherapy, radiotherapy, or some oncological reason. Another who has early menopause station, of course, with high factor of genetic disorders in their family or their previous baby, who has some surgical process and it's interrupt ovarian reserve, who has many cycle and they receive already abnormal morphological eggs, if patient have born but already has unfunctioning ovaries, and who has many trial but no receive eggs, that means low ovarian reserve or no reserve at all, and of course with many unsuccessful IVF trials who didn't achieve any kind of pregnancy. So first important things, how we are following up our egg donors as laboratory, embryology laboratory. Of course, we have agency, we have team for the recruitment, we have team for the medical side of analyzing of the donor. But what we are doing in embryology lab, when we have already in our hand a recipient, a donor. Of course, we have different kind of software management system which we are controlling through embryology lab between donor and recipient relation. Of course, we have Dr. Alex, our medical software, which we are following up all direction from our medical doctors and our reception. So if we have requests, so we can see daily on the daily program, weekly program, when we have donor, when we have recipient, if we have frozen cycle, when we need to talk. So this connected to our CRM database and also our egg donor website, online website, which you are choosing and which you get online your egg donor. So between these three software, we can able to get all information about donor and recipient in embryology laboratory, and we can prepare all culture media protocols, lab SOPs according to this direction. Also, of course, we are supporting all of this system with special witnessing system to protect biological security of your material as a recipient and donor egg material. Of course, also CRM giving kind of chance to our agencies and our team to control egg donors according to their medical treatment, their injection time, and other specific things. So if we look at egg donation from IVF laboratory perspective, what we need to know exactly, what we are analyzing as embryologists. We analyze medical history of recipient, egg donor medical history. If this egg donor have previous cycle, how was the egg quality, what kind of blastocyst outcome and pregnancy we got this egg donor. Also from recipient side, how is the sperm factors, male factors, what kind of advanced technique we need to use to achieve much faster and good pregnancy, biological safety of the egg donor of recipient. We need to use some special advanced technology to protect their biological safety. Donor egg quality determination, I will talk in next slides. We have very strict criteria about donor eggs which we are choosing for egg donor program. Possible advanced techniques for the fertilization and embryo development process. So we are using different kind of culture media. We are using time-lapse technology. Also another advanced technology which I will talk in next slides. Also, of course, safety and quality management of the cryo donor eggs. So, of course, first we need to know about structure of a mature oocyte. So, as a mature oocyte, quality of mature oocyte has zona pellucida, which is protecting inner DNA material from environmental factors, which will give damage to oocyte, which will protect nuclear area, cytoplasm, which will feed by the energy to nucleus, and nucleus which will keep all DNA material. So this is the basically a high quality of mature eggs, which we have to take care of the quality when we freeze or when we use for donor egg programs. So as you see the slide about woman age for the reproductive performance. So while woman age is increasing, of course, reproductive performance is decreasing. So this is general conception, natural conception of IVF. What about egg donors? Of course, egg donors also have similar situation. When we see the this article, so while donor egg age increasing, of course, live birth rate and high quality of blastocyst rate also decreasing. So while a donor age under 35, so almost we have higher live birth rate. So egg donation logistic advantage if we compare between fresh egg donor and cryo banking. As fresh advantage, of course, no freezing. That means no risk. Depends of which laboratory or which clinic you are working on it. Because every embryologist and every laboratory doesn't have a big experience for egg banking or vitrification of oocyte. If we look from oocyte banking, like in cryo egg banking, of course, advantages a lot. First is no synchronization donor or recipient. You can use anytime your eggs, donor eggs. Of course, it's the safety of the recipient. And another important factor, no number of embryos like 10, 12, or 15, which you don't need to use. Of course, you can use a different number of cryo donor egg, which you need. If we check about Spanish experience, while we see between fresh egg and cryo egg on the donors, there is almost no difference for the survival rate of the egg bank, which we told oocyte, almost 92% egg are survived, high quality of egg, and we don't see any kind of difference on the clinical pregnancy rate, almost the same. Even cryo egg bank supply higher pregnancy, live birth rate than fresh egg. So also if we check about quality of embryos, again the same situation. There is no difference, significant difference between cryo egg and fresh donor eggs. Also if you look about ongoing pregnancy, so almost even egg bank has better pregnancy rate than fresh, but it's not a significant thing. So while another diagram is showing, okay, between natural IVF conception and egg donor conception, there are differences for the age, for the probability of live birth rate. You see for the red line, this is the natural IVF conception. After 35 years old, it is dramatically decreased. But in the donor egg, if you are a recipient even with higher age, still you have big probability of live birth rate with the donor eggs. So here is the main question: will I have IVF success with donor eggs? Of course, you are efforting to financially, you have a big hope, and this is the main question what we need to give answer. So for that, what we are doing in IVMED clinic, of course, there are many different kind of eggs from the donor which we supply after the stimulation, after the egg pickup. Of course, we have a big criteria, selection criteria, which egg we will freeze for egg banking. We are checking the perivitellin space, which will allow calcium and other metabolic activation between wall and oocyte membrane. Zona pellucida, which is protecting polar bodies, which is determining the maturity of oocyte. Cytoplasmic inclusion, which is helping between genetic material and energy activity. And of course, cumulus complex, which is protecting oocyte to outside factors. So there are a lot of different kind of research for the fresh donor egg or cryo egg. They try to compare. So if we check this, so if you look about survival rate, almost very high between vitrify, and fertilization rate almost similar. So also embryo transfer rate almost similar. And if we check implantation rate, 25% to 24% is totally same. And live birth rate, even vitrify oocyte has higher live birth rate than fresh oocyte. Of course, this is because of timing. So we have enough time to prepare endometrium as well. When patients have a more time for endometrium preparation, we have chance to make advanced techniques, PRP as one of the techniques, so we can develop endometrium well. So that means our oocyte or our embryo is already frozen and we have time for that. So if we check the video, I want to show you basically how we are vitrifying egg. So because mostly when we say vitrify oocyte, mostly patient a little afraid. So they have question if my donor eggs will become thawing better. If we saw this is under high percentage of equilibration media with high concentration of media, we are trying to make exact concentration inside of cytoplasm to protect our genetic material inside of donor eggs. So when we try to use such vitrification technology, this is high security technology and faster technology for the oocyte vitrification, and this is almost has best survival rate. There is no chance to get any kind of risk during thawing and vitrification if embryologist has special experience. We are using special embryo tested freezing carrier to protect our eggs during storage. If we look another technology which we are choosing also frozen egg from the donor, this is spindle weave technology. This is rare technology which using by the clinics. So spindle weave technology is showing us exact the place of spindle. Spindle is very important because spindle carry up all chromosomal activities, and still 20% of eggs after pickup, we don't have chance to determine spindle, or if we make the fertilization, we have chance to give damage to spindle. So in this case, of course, this oocyte either will not survive, either will not give high quality of embryos. So what is the benefits of spindle weave technology for the cryo oocyte or egg? So for the ICSI, of course, if we use the spindle technology system, spindle weave system, we totally eliminate to give damage during fertilization, during injection to oocyte. Of course, egg freezing, if we determine after the punction spindle place, so that is a huge advantage. That means this oocyte after the thawing will survive for sure, and also will give high quality of blastocyst. And of course, also we have possibility with spindle weave technology, we can measure zona pellucida, and zona pellucida will give us big advantage. This egg is exactly good dimension or not. So if we look the video how we are determining spindle and how we do by the spindle weave technology fertilization. So with this technology, we already, as you see on the 7 o'clock position, already has the white color of spindle. So while we do ICSI by this way, and needle and spindle is totally different location, so that will not be have chance to give any damage to spindle. So DNA material we will protect by this way. Spindle can be at different places always. Sometimes can be on the 3 o'clock position where we are doing injection. Sometimes can be under the only polar body at 12 o'clock position. So place of spindle is changeable. That's why this technology will give big advantage for the survival rate and for high quality of embryo. There are several research about meiotic spindle. So size of meiotic spindle also is important, and we are also considering when we choose our donor eggs which we will freeze. So as you see there, while size of spindle is ideal, so that means fertilization rate is much higher, degeneration rate is much lower, and good quality of blastocyst rate is much higher. Of course, also spindle size affect pregnancy. So ideal spindle size, as you see on the middle, almost have double a pregnancy rate than others. So spindle size is one of the main determination factor for the egg quality or embryo quality. So who will benefit from spindle weave technology? Of course, who has advanced maternal age, low anti-Müllerian hormone, previous poor IVF embryos with normal male factors, poor looking oocyte in previous IVF, previous poor fertilization with ICSI, assessment of oocyte optimization therapy, frozen and thaw oocyte assessment, and high quality of cryo donor oocyte. So how we are doing cryo donor egg transportation? Of course, also we have many requests as IVMED. So we have an egg bank, and so different location in the different country can try. Also, patient can request donor eggs, which country has legal issue for egg donation. So we are able to transport our donor eggs also to different countries for our patient use. So how we are doing that? We have, of course, special transport guidelines. We are using special dry shippers, which is keeping with exact temperature and condition donor eggs. So with the new technology, we can also follow up with the GPS system. Where is the dry shipper? Where is the courier? And in the time lapse, we can see the temperature, we can see the nitrogen level, and we can keep safety during transportation. So there are kind of research. They checked storage risk during the donor egg transport, and they finally find out, okay, main things about storage and transportation is the quality management. So while quality management is very important, we have to use special guidelines for that, special material for the cryo storage, dry shipper, and material which we are transporting to another country. As cryobanking, where we are keeping our donor eggs, also this is important. We are using special automation and also special dry shipper and container, which has already data logger. This data logger is already connected to our main computer and also connected to our cell phones. So with special application, we can follow up our cryo storage anywhere else. Also, we are using tank control system. So with special identified chip and labeling, we can see the exactly place of egg donor. We don't need to take many different material outside and try to choose. We know exactly where is the place as automatically. So how is working? Cryo tank control. We have special RFID chip in each cryo device. With this RFID chip, when we read with card reader, we can see the all information about donor and recipient automatically by the software. So we can determine place of the egg donor, and we take without any risk this cryo device. So as you see here, the diagram of the cryo map, so which you see with the yellow, that means that cryo donor still didn't use, which you see with red, that's already used. So this is automatically is going this information to our donor database, online donor database, and you are able to see which donor is available or which donor is not available. So what is our transportation process if you buy donor eggs, cryo donor eggs from IVMED? Of course, we always transport frozen donor eggs, embryos or sperm in a highly specialized container. We always ensure that minus 196 Celsius should be transportation process. We use special cryo materials. That's why we have special permission and documentation. So your biological material or cryo donor eggs will never pass through X-rays. We use only dry shipping containers, which has special proof from International Air Transport Association. Also, we can follow dry shipper by the GPS system, and our dry shipper can keep donor egg, cryo donor egg under high quality at least 2 weeks. So one of the important questions, what I should do if my budget is limited for egg donation? Of course, that's a big question because everyone cannot organize exactly budget of full donors. And in this case, of course, frozen donor eggs is helping cryobanking. By the cryobank system, you can buy how many eggs you want, and you can pay less amount. So this is the one of the big advantage for the egg donor programs in IVMED. So we have different package for different budgets. So if we come about our result, about our outcomes for egg donation process. So if we look about 2018, so our egg donor average was 29 years old. So almost fertilization rate is 96%, really high. If we check the blastocyst rate, up to 60%, 62%. So it is almost giving high chance for the pregnancy. If we look 2019, egg donor age average is 28, fertilization rate 93, and CRYO rate of blastocyst stage 74%. It is really high. So number of donor we done 308, and number of donor oocyte we already used for the programs 5,424. So if we look at the diagram, the different statistics, so almost 74% of general blastocyst rate for the donor eggs programs. Doesn't matter which age is the recipient, and male factor, any male factor included. Fertilization rate almost 93%, and grade 1 embryo rate almost 70%. So also, if we compare these results between USA Fertility Statistic Agency and UK agency, so we can see we have better outcome for the fertilization rate and also cryopreservation rate. If we check the freezing and thawing statistic, because this was the big question for the survival rate, as we see in IVMED, we froze 3,456 oocyte, we thawed almost 1,986 oocyte, and survived almost 1,969. So almost 99% of oocyte survival rate we have. So why we are different as IVMED clinic for egg donation program? We use fully technology for donor egg banking. So for egg choosing, freezing, storage, and transportation, we follow special criteria. We use only elective donor egg freezing. So one donor, if we want to use for cryobank, should pass many different criteria from the egg pickup till freezing. We use high security witness system for donor egg following from egg pickup to embryo transfer. Why this is important? Because you will feel totally safety as recipient during your embryo transfer, also during your embryos prepared by donor eggs. Only well-experienced senior embryologists freeze egg donor for the egg bank who has up to 10 years of experience. As I said, embryo freezing and oocyte freezing is not the same. Oocyte freezing is much more sensitive and needs huge experience. So what we are doing during COVID-19 pandemic, how we are protecting our cryo storage, our cryobank. Of course, we are following special guidelines of European Society of Human Reproduction and American Society of Reproductive Medicine. So according to their guidelines, we are trying to use special disinfectant which is tested for biological material, which we know there is no damage. All kind of material which is entering the laboratory, sterilizing by UV and special disinfectant, and also limited embryologists working in the lab with special security condition. So thank you very much for your time and for your attention. So after answer and question, we will discuss about your questions.
Thank you very much, Birol, for your interesting presentation. I want to remind you that we have active chat. You can ask your questions in it, and in a few seconds, the next speaker will proceed with presentation. Birol, you can stop your presentation. And I would like to also remind you that we have a big choice of different egg donation programs. We will dedicate one of the next webinars to just to tell you about all these programs which are available now at IVMED. We will tell you about the differences, different options, different budgets, and we hope that will be interesting for you. And now we will give the floor to Dr. Galina. You can start, please.
Thank you very much. Hello. I am really happy to be present and to give you some information about egg donation. Now I will try to switch on my screen. So now we will talking about egg donation. Birol hopefully explained very well all technical parts of this program. And my task will be to explain how it is organized, how we found our egg donors, where and how we investigate them, and what about the results. So we will start about discussion. Is it really interesting for our patient to do the egg donation? How often patients interested in this program? Who are our egg donors? Then I will give information about the official requests of Ukrainian Ministry of Health about examination of egg donors. Also, we'll talking about results of our egg donation program and about other important things. So, European Association of Reproductive Medicine published information that around 7.7% of all ART cycles are egg donation cycles. This is information published in 2017. Actually, proportion will be more or less the same, maybe 8%. Numbers maybe will be more important. Important is that around 50% of all treatments of egg donation have done in Spain, because in Spain legislation is very flexible for egg donation, but as request is so important, in Spain it is quite difficult to realize this request. That's why Ukraine became more and more popular as a country where you can do egg donation by very professional and by very safety way. So this is the slide of Ukrainian National Register. Published this year, but information collected about 2018. And we can see that this register exists since 1999, so more than 10 years, and 20 years, and we can see that we have constant increase of general number of cycles. We have dramatically increased this rows column, the number of cryopreserved embryo transfer. This shows that it is absolutely safe and absolutely effective technique. And also we can see that we have a quite important percentage of egg donation cycle in our country. So European community show around 7.7%, and in Ukraine it is proportion is 8.3%. So it is more or less the same, but even a little bit more than in Europe. In our clinic, we also have constant increase of general number of ART cycles and of egg donation cycles as well. In 2019, we have done around 300 and something, 308 or 309 egg collections for egg donors, and around 1/3 of all our IRT program were egg donation program. So, how it is organized, our egg donation programs? We have very beautiful, very nice international department, and this department divides in 3 parts. Subunit of egg donation, of organization, and contacts with international patients. Our international department always take into consideration the Ministry of Health order number 787, which describe the order how to choose, how to investigate egg donors, who can be egg donors, and how to proceed this procedure. So the main requirement is should be woman, age between 18 and 36. In our clinic, we mostly require before 32 years old. But according to the Ministry of Health order, we can, women before 36 can participate in this program. The second important things, women who would like to be egg donor should have as minimum 1 healthy baby. It is very good condition because all our donors has proven fertility. If they were able to have healthy baby, it means that they are healthy and they have good fertility. Absence of negative phenotypic manifestation, it means no some hereditary problems, some disease. She should have some normal good somatic health. Has no general contraindication to participate in egg donation program like some disease like coagulopathy, like infections, and absence of negative habits like drug consumption, alcohol consumption, and other substance abuse. And this we always control with some specific tests, and each visit, each control, each monitoring, we control with this test that our egg donor doesn't use substances. So according to our Ministry of Health order, we should do a lot of different examinations. I will not read all this examination, but it is the same request as, and even more than requested in Western country like Spain, for example, or like United States. We are doing all general infection tests like HIV, hepatitis, syphilis. Also, we're doing a lot of infections like chlamydia, mycoplasma, herpes, etc. And we're doing a lot of general analysis, which can help us to understand that this egg donation will be safe for our egg donor, and we will not have complications with the health of egg donor. And also, normally, we are doing some genetic tests, obligatory, it's CRYOPRESERVATION, also diagnostic of cystic fibrosis, Martin-Bell syndrome for X, spinal muscular atrophy, also hereditary deafness, phenylketonuria. Why these mutations? Because we have studied the most spread and most often mutations in our population, in Ukrainian population. And we have chosen these mutations as most often. If patients has some specific requests, of course, we can do some specific analysis for them. We are doing some kind of storage of genetic material of our egg donor. And even in 1 year, in 2 years, 3 years, if patients will ask us to do some additional tests, for example, because some health problem of children or some question of the pediatric of these patients, we can do this additional test because we have genetic material stored in our clinic. So some obligatory documents which our donors should provide is official passport, fiscal code, birth certificate for children, also they fill a lot of official consents decreed by the Ministry of Health. Also, they should provide us report by psychiatrists, like also by oncologist, that they have no problem, general practitioner, and some additional tests. One of the main analysis which we take in consideration is the level of anti-Müllerian hormone. There are a lot of scientific publications about the IMH level and risk of ovarian hyperstimulation. Normal hyperstimulation when we receive more than 20 follicles. So this is the point which we are searching in our donors, because we should receive more eggs, not 1 or 2, but a good number, to have a good choice and to provide to our patients the guarantee to have genetically normal embryos. Our criterion to choose our egg donor is to have anti-Müllerian hormone more than 3.5. This is the level for which most of authors and most of scientific publications say that it will be very good responder, and even may have ovarian hyperstimulation syndrome, but only in case on some specific protocol of stimulation. In our clinic, we use protocols of stimulation and triggering of final oocyte maturation, which exclude ovarian hyperstimulation syndrome, but we receive always good number of eggs from our donor. So, how we select our donors? First, there are some advertisement and some marketing, and we have calls of donors, contacts, and our call center speaking with them and doing the first selection. After that, we invite our egg donors to interview, and if they pass this interview, they are invited to first visit to our clinic. So, doctor should do first examination. After that, psychological consultation will be done, and we take blood for some infections. After that, part of donor exclude from the further program, and some of them include. And then we are doing some specific tests, like genetic tests, like nasal infections, and further investigation. So, our selection is quite strict, and you can see that only 3.3% from potential candidate to egg donor who called to clinic to ask and to discuss the possibility to be egg donor became finally our egg donor. At the present, we have 215 active egg donors. It not signify that our database only 200. It means that some of them actually cannot stimulate, made stimulation. Some of them decide to stop. Some of them take pause. Some of them have done 3-4 stimulation and decide to not continue. So from all our database, actually we have 215 egg donors who are ready to working with us. Every month we receive around 300 calls from candidates to be egg donor. We accept after the first selection around 20 candidates for the first visit. And in 2019, we have around 254 candidates, and after all examination and selection, only 119 became egg donors. So you can see from this slide that our method of selection and investigation are quite strict. So who they are, our egg donors? Around 20% has university degree. Secondary specialized education is like college is around 50%. Secondary education also around 20%. The percentage of our egg donors with high education is a little bit less than in general population, but maybe because on young age and because they are living in area with less access to education maybe. Most of them are working, 91%, and average number of children that they have is 1.5. Less than 1% of egg donors were found to be positive for hepatitis, syphilis, etc., for serious infections, and such women, of course, were excluded from the further program. Some sexual transmitted disease, sometimes found mycoplasma, ureaplasma, but nothing special, and some of them we can treat and then control, and some of them are excluded. Sometimes we found leiomyoma, ovarian cyst, dysplasia. All this disease we exclude from participation of our donation program. Genetic abnormality is not very often, 3.5%. Of course, all these girls are excluded from egg donation program. Of course, we inform them what it is to explain the situation, but we are not propose them to continue. This is the results of genetic and molecular genetic examination. So, spinal muscular atrophy around 3%, fragile X around 1.4%, cystic fibrosis 2.7%. It is more or less similar general population, but it makes sense to do all this investigation and to exclude the people who are part of some mutation, and they will not participate in the donation program. So the average age is around 28-29 years old. Birol have shown that it is a little bit different year by year, but in general it is around 28-29 years old. Most of our egg donors, 68%, is 26-30 years old. The average oocyte number 2019 is 17.6. Mature is 16.6. Fertilization rate is very good. And in average, we are freezing around 11 or 12 blastocysts. Our egg donation program, it is a very good number because the average number of genetically normal euploid embryo is around 66%. So average number of euploid blastocysts is 7.6. It is absolutely enough to receive, to doing 2, 3, 4 transfer and to receive for sure pregnancy. I will explain why, because the average pregnancy rate per cycle with NGS is around 73%. The average number of embryo transfer in the donation cycle we have calculated is around 1.4. It means that most of patients prefer to transfer one embryo, but some of them prefer to have twins and ask us to transfer two. So to receive to have the fertility rate around 80–90%, like in natural life, yeah, need to do around 2 embryo transfers, so we need around 3–4 employed embryo, and in average we have 7–8. So it is absolutely enough to have a good result our egg donation treatment. So what about employee rate? We compare our employee rate with published information from another country, and we can see that the average rate is of employee egg donation program is 65%. Some clinic published 42%, some clinic published 80%. Discuss why it may be less or more, and say that it may be hormonal stimulation, maybe laboratory condition. But as we are in average rate, we can say for sure that we have good hormonal stimulation regime, very good laboratory condition, absolutely good embryo manipulation method, and environment. Why we have not 100%, of course, some effects of genetic abnormality. Also, we should mention that age of father may be important. I will explain why. This is that I have told that NGS in our clinic gives 66% of genetically normal embryo and only 2% without diagnostic or mosaic. So age of father. There is some examination named DNA fragmentation of sperm, and it was where rate of unemployed of embryo and age of father and this DNA fragmentation. If we have young age of father, less than 39 years old, we have quite a low level of this DNA fragmentation. Normal range is less than 30%. Yeah, and unemployed rate is around 50–60%. Yeah, but if we have advanced age of father, we can see that DNA fragmentation rate is around 40%, and unemployed rate is quite important, much important. So we compare the situation in our clinic. The average age of men who have done DNA fragmentation test is 35 years old. In egg donation program was a little bit more, 42.7 years. The difference is not so important, but we have found that frequency of increased DNA fragmentation in young men is around 24%, and in men, egg donation program is around 39%. So much more often we found this problem. And if we detect the high level of DNA fragmentation of male partner, necessary to take into consideration that some simple things may improve the probability to have genetically normal embryo and good quality sperm. So we should thinking about lifestyle modification like normal healthy eating, like sport activity, physical activity, to not smoke or drink alcohol. Also necessary to control infections, because 35% of cases of male infertility may be due to some infection problems. Most of case embryologists propose antioxidant therapy like vitamin C, like vitamin E, like folic acid, also cell. This is the condition where veins of scrotal part is enlarged, and it is increased the temperature in testes and produce quite often the of DNA fermentation. And it was found in around 35% of patients with male infertility. And in some cases, the surgical treatment of this cell may decrease the DNA fermentation level and improve parameters of sperm count. Sometimes, if we have very high level of DNA fermentation, we can do the micromanipulation retrieve of sperm from testes. And in this case, we receive 5 times lower DNA fermentation level than in ejaculated sperm. Also, we have some method to select sperm like sperm chip. There is a specific device which permits us to select the best sperm cells, best motility and better maturity, and without DNA fermentation. Also important question which some patients ask us is the security of the donors. Of course, it is very important because according to our Ministry of Health order, we should control our egg donors 30 days after egg collection, and if any questions, any problem happen, we always help donor to resolve this problem, to control all medical conditions, and it is our duty, we can say like that. According to our Ministry of Health order, we cannot stimulate our egg donor more than 8 times. We will all necessary examination and control results of laboratory for each stimulation. And all controls repeat every time before the new stimulation. So, I can say that the donation program in our clinic is really good organized because we select very well our potential egg donor. We are doing very, how to say, gentle but effective controlled ovarian stimulation without ovarian hyperstimulation syndrome. Preparation to embryo transfer of our patients is individual, but it is the topic, how to say, we cannot explain all concerning the preparation to embryo transfer in 5 minutes. It is a very serious topic, and maybe one day we will do new seminar dedicated to this topic. We have very good laboratory support to our controlled ovarian stimulation and IVF programs, and that's why we have very good results of our egg donation program. So thank you for your kind attention, and I will be happy to answer all questions.
Thank you very much. We have questions, a lot of questions.
Excellent. With pleasure.
Hello, dear doctor. I have done 8 IVF with my own eggs. I have 1 child now, and one of them was ectopic, and one was maybe 1 pregnancy with 4 babies lost. Of them at 26 weeks. 2 other I lost at 6 weeks and 1 at 11th week. And I sent to genetic test. It has abnormality at chromosomes. I am 41 years, and what is your recommendations for my next trial for IVF? Do you think donor eggs will be better for success this time? Thank you so much.
Thank you very much for your question. It is really difficult situation. The last pregnancies were genetically abnormal, and that's why they stop at 6 weeks, I think, because, okay, at 40 years old, around 80% of all embryo will have some genetic abnormalities. This is the statistic of genetic testing. So, of course, if we will use egg donation program in your case, the probability to have pregnancy and to have normal pregnancy, healthy pregnancy is much higher. But from the other hand, it will be, how to say, a little bit different. Of course, we can try also use your own eggs, but in this case, it will be good to test your embryos, to do NGS testing, next generation sequences testing, to see all your chromosomes and to choose only embryos with normal genetic. Unfortunately, it may be that we can receive, for example, 10 eggs, 8 embryos, 5 blastocysts, and even no one will be healthy. This is the risk to working with own eggs after 38, 40 years old. So in your case, I think the probability to be pregnant and to have healthy baby, of course, much higher if we will use egg donation program.
Thank you. And the next question to Birol. Is vitrified embryos what you prefer to work with if you have a choice?
Yeah, actually, that is the one of the question everyone wondering. So for me, always I prefer frozen embryo transfer, frozen embryo, because frozen embryo give two big possibilities. First possibility is from endometrium side. So we have enough time for the IVF specialist to prepare endometrium well. So if she has, if IVF specialist has some advanced therapy or something, so we'll have plenty of time for that. And second important things, of course, frozen embryo specially selected for the criteria, special criteria. So that means frozen embryo and regular fresh embryo has a difference for the different selection criteria. When we have the fresh embryo, exactly we don't consider as morphologically 100%. So if morphologically looks well, so we transfer this embryo. But when we have frozen embryo and if such embryo back from the frozen as healthy towing, high quality of towing, that means this embryo has also high morphological capacity. So at least we already 2 times tested this embryo. Of course, this embryo has more potential than fresh embryo. Same things, I have idea for the fresh oocyte and frozen oocyte.
Thank you. And from the same person question to doctor, perhaps, what are the most common infections that you can see, maybe between egg donors, as I understand?
Okay, if we are talking about egg donors, the most often we found mycoplasma infection.
Sorry, there is a detailization in IF. Not donors, IF.
Recipient, probably.
Recipient. The same.
Fathers, in fathers.
In fathers. We are doing the spermoculture, and the most often it is the general microorganism like ESHRE coli, like Enterobacter, so nothing special. In most of cases, we doesn't found some specific infections. We found, how to say, dysbacteriosis, not normal equilibrated bacteria inside of organism. I mean that in most of cases, it is some disbalance, and antibiotic treatment may help for some period, but after it may return this kind of infection. So it is quite difficult to eradicate them, but sometimes antibacterial treatment can be helpful, and we try to control as minimum the situation.
Thank you. We have a question. Hi, am I understand correct? There are no difference in using fresh or frozen eggs, but I saw information fresh eggs have higher implantation rate, maybe to Birol, because you told about that.
Okay, of course, different clinics and different organizations have different results. Of course, this is, as I said, this depends of experience. Okay, cryopreservation of egg is not so easy like embryos. If you have enough experience and enough advanced technology, you will have better outcomes. Basically, there is no difference, significant difference between fresh and frozen oocyte for the live birth, for the implantation as well. Fresh, this is true, fresh oocyte a little bit higher implantation rate, but for us is the basic result is the live birth rate. So live birth rate, if we check all research, is proof that frozen oocyte has better live birth, but again, I'm saying it's not significant. We are talking about only 2-3% difference.
Thank you. And thank you for very informative presentation. For how long can oocytes be frozen? Does it affect fertilization?
Okay, period of cryo storage, as different research shows, there is no effect. There's already published article with the delivery of 13 years of embryos and frozen oocyte, which thawed and became healthy pregnancy and live birth. So there is not exactly a limited period, depends of how laboratory or clinic storage, how they make the quality management and safety control of biological material.
Thank you. I have a question for embryologist, please. How do you freeze oocytes during COVID-19? Are there special protocols during pandemic?
As I explained on my presentation, okay, we are following for that ESHRE and ESHRE guidelines. So we are trying to avoid all risk factors during cryopreservation. We are using only high quality embryo tested material, any material which we are taking from the outside the laboratory, disinfected by special tested, disinfected and UV lights. So only one person by the sterile condition is working for the cryopreservation in one room. There is no access of other staff or person to that room. So by this way, we avoid all kinds of cross-contamination.
Maybe also to your question, I had such experience when one of my embryos did not sow. Is this possible? What's the reason?
Okay, this depends of quality of embryo and oocyte. Okay, oocyte is more sensitive. What kind of oocyte we are choosing for the freezing, and who is freezing this oocyte or embryo? Actually, there is, even with low quality of oocyte, there is not a big question for the survival rate. This depends of technique, depends of experience of embryologist, and freezing or vitrification media which we are using. But of course, still possibility, there are possibility after the thawing, embryo or oocyte cannot be survived.
Thank you. We have a question, maybe doctor can answer. I have one more question. I'm unmarried and want to try egg donation. Can I?
Thank you for your question. Very interesting question. But there is no restriction in Ukraine to do egg donation if you are not married. Some countries not permit that, but in Ukraine there is no restriction. You can choose egg donor and sperm donor as well. We have also the possibility to provide you quite big amount of different profiles. And also we have the program of embryo adoption. So we have ready embryos with donors eggs and donor sperm, and you can choose ready embryos. It is more easy sometimes and more quickly. So there is no restriction to you.
Thank you. And I also want to ask the doctor, how do you organize egg donor stimulation and egg retrieval during COVID-19? It seems very important.
Yeah, recently European Society of Reproduction and Embryology published a guideline, and we are organizing our work with patients and with egg donors according to this guideline. So at the beginning of the treatment, we are doing the check, the control of health of donor. If donor has some symptoms, we are doing specific test to COVID-19. If no symptom, we start the stimulation. Also, before the egg retrieval, we repeat this control of health of egg donor. We are using also some specific protection clauses. All staff of clinic wearing mask and this specific protection clauses all the time. Before it was only in operation room, but now we are working only like that from the reception to the operation room. Also, we try to organize our work to not have a lot of patients at the same time. And also we try that they stay in clinic with the distance at minimum 1.5 to 2 meters between the patients. In each room, only one patient after operation, after surgical intervention or before may be present. So we try to organize like that.
Thank you. Hello, I'm 36, tried several IVF, but unsuccessful. I want to try my own stimulation, but afraid there will not be any embryos. Can I do my stimulation and egg donation in your clinic?
Okay, thank you for your question. I'm not completely understand, but as I understand the question, if we can do at the same time egg donation and own stimulation. Yes, we have this kind of program. We can try the own stimulation. And at the same time, patient can choose from our CRYO bank of egg donors some number of eggs, and the day of egg collection we receive own eggs and thawing donors' eggs and made fertilization at the same time. And we can see if own eggs and own embryos have good quality, we can use them and freeze donors' embryos. Yeah. If just opposite, own embryos will stop their development or will be not very good quality, or for example will be genetically abnormal, we can use embryos from donors' eggs. Like that, we will not lose time for preparation of endometrium, and we can do the transfer in any case.
Thank you. And we have one more question, maybe last. What about the length of period that sperm should be frozen that still maintains quality? Maybe to Birol?
There is same situation like OOCYTE, it's the same question. There is no special period which we measure can give damage length of cryo storage. So also there are published article, 15 years old frozen sperm thaw and give high quality of embryos and live growth. So there is no restriction for length of sperm freezing as well.
Okay, thank you very much. If you have more questions, you have questions, okay. Birol, sometimes freezing conditions were different longer ago. Can you read it in the chat, please? Maybe before.
Exactly, also I couldn't understand, but freezing protocols. Okay. So if we are talking about oocyte, embryo, and sperm, of course, for all of them, we are using only vitrification fast freezing protocols. There is, of course, standard protocols for everyone, for every clinic and country, which they are using. Only that we are changing the criteria which we are choosing for freezing, and also composition of the media and timing for the freezing. So we are following according our experience, which give best results. So we are following that way. Actually, I show also Dr. Galina show on the statistics. So we have really high survival rate for the oocyte and embryo towing. That is the one of the script. So of course we are working a selective method, and secondly, we built our own towing and freezing protocol.
Yeah, there is maybe some again detailization that the question was about that the embryos were frozen quite long ago.
Okay.
Techniques was old.
Okay. So if it is, of course, 15 to 20 years ago, that is mostly slow freezing. So now we changed the protocol. Now everyone is using rapid protocol, but still kind of media and embryologist experience able to tow even 15 to 20 years old embryos. Of course, for oocyte system will not work such high quality, but for embryos, there is no risk. Even with 20 years ago frozen embryos, we can tow safety and without question.
Okay, thank you. That will be maybe enough for today. We thank you to our speakers. We have some kind words from our visitors. So if you have another questions, you can send to us to contact IVMED.com.ua. Our specialist will give all answers if you will need. And thank you for your watching us, and see you next Friday. Again, we will have a piece of interesting topic for you, held by Birol, about our lab, how it works, how we store the biomaterial, is it safe, there are safe conditions for storage, should you worry about how your embryos or cells are being stored, or there is no chance or no reasons to be worried. Thank you. See you next time. Stay safe and healthy.
Bye-bye.
Bye-bye.
Bye-bye.